But in general, with chiropractic, there's over 200 techniques that have developed from day one, if not even more. Okay, there's diversified, which is more of a hands-on. You hear the audible cracking. You have an activator, which is the use of a tool to put a slow impulse into the vertebra. You're not going to get that audible cracking or pop that people think about when they think about chiropractic.
So when you in-toe, you're winding the fascia in, you're turning the diaphragm inward on itself, and then you feel a restricted sense of breathing. You duck your feet and you take a breath. It just opens up much less restrictively, very easily. And so that's what's happening to a pregnant mom.
Liver is not working properly. We get a buildup of those toxins. Buildup of those toxins is going to make it so that your stomach may not be digesting as well, getting it back up there. And when we get that, it builds up in the whole system. We get back in the lymphatic system. We can get the headaches. We can get the misfiring of the nerves down the arm, all that. So, working, organ work, adjusting, cranial work, we're allowing that body to function at an optimal level.
So that's why sometimes you see babies have an Egyptian-style head or elongated posterior, or there might be overriding sutures, because with that baby getting squeezed in the birth canal, designed to help so the baby can come out.
Yep.
We're not going with a bowling ball head that,
Yep.
Welcome to the Dr. Thornburg Wellness Podcast, where pediatrics meets functional medicine, blending science-backed insight, common sense, and a touch of shamanic wisdom from a father of 8.
Hi, I'm Dr. Brian Thornburg. On this week on You Asked, I am sitting with Chris Organian. He is a chiropractor. I've known him for many, many years, and he works with a lot of professional athletes. He works a lot with high school athletes and a lot of mother-baby combinations, and that's how we first were introduced, because his waiting room looks a lot like my waiting room with the same patient. So we've developed a good relationship, and I thought it'd be great to get some questions answered about chiropractic care, newborn care, and what they're doing. Well, welcome, Chris.
Thank you. Appreciate you having me here today.
Yeah.
It's an honor to be here. You're one of the people in our community that everyone looks up to as a pediatrician. And, for me, when I first started practice, I was all about the sports and athletes, but the more I was working in a practice where we had a lot of pregnant moms and babies, and that actually became my passion. So love pediatrics, and I'm glad you have me here today.
Yeah, no, it's going to be great getting into all of this.
Yep. Awesome.
So let's go back to, kind of the history of medicine, because most people think that medicine, chiropractic, osteopathic, allopathic, has just been practiced the way it is. So just for some context, the MDs have been around for forever, right? But the way they practiced medicine in the 1800s was very different than they practice now. So they didn't have the scientific method. There weren't antibiotics, there weren't vaccines. There was very primitive surgery, but that was primarily done by barbers and not by medical doctors. In the United States, there were over 400 medical schools in the 1800s in the U.S., but they comprised a lot of different types of medicine. So there were eclectic MDs, spiritualistic MDs, homeopathic MDs, what we'd call traditional MDs. And the medicine they practiced was largely purgatives and poisons. So they would give you strychnine and arsenic and mercury and bloodletting. And so, again, it wasn't a scientific method back then. And just really hit it home in 1865 or 1870, the president of Harvard University asked the dean of the Harvard Medical School to implement a written final exam for their graduates at Harvard for medical school. And the dean said, we cannot implement a written exam for graduation because most of our students don't read or write. So what we think of medicine today is not what medicine was in the 1800s. And so out of that environment of using mercury, strychnine, arsenic, bloodletting, medical doctors didn't really read or write back then. And there was a westward expansion, and most medical doctors stayed in big cities. They weren't going to get trained and then go live in the Wild West. Right. And so there was a cottage industry of, well, I have a little bit of curiosity in medicine, so I'm the town doc, but I really wasn't a doctor. I was just a lay doctor. And obviously, medical care was always a coin flip with that kind of situation. And that's where your profession and my profession grew out of. We grew out of it wasn't working so well with the MDs. And so I believe the chiropractic profession was first founded in 1865. Is that when it was?
1895.
1895. Mm-hmm. It wasn't. I thought it was earlier.
No.
No.
D.D.
I mean, you would
Palmer,
know. You would know. I mean, the reason I say it's earlier is because osteopathy. So osteopathy was founded. The guy that founded osteopathy was Andrew Taylor Still, and he was a formerly trained medical doctor. So he wasn't a lay physician. He was formally trained. He was also a minister, a man of the cloth, and he served in the Civil War. And in 1865, he lost his wife and 4 of his children to the traditional medicine practice of the time, all in 1 year.
Wow.
So that sent him obviously head spiraling down, and oh my gosh, I've just lost my entire family to the medicine that I've dedicated my life to. And he leaned into God and did a 10-year spiritual sabbatical. And at the end of 10 years, in 1875, then he founded osteopathy. And I always thought that osteopathy and chiropractic developed kind of at the same moment.
No, we were probably, like you said, 20 years probably after. If that was
I didn't know that. Okay.
1875, we were 1895 with D.D. Palmer.
Okay.
And that's when that chiropractic started, technically.
But really close to each other, because osteopathic was founded in Missouri, in Kirksville, and you guys were in...
We were in Davenport, Iowa.
Iowa.
And D.D. Palmer was actually a metaphysical healer. That's where he actually started out as, and he was working as a janitor as well during the time.
I don't know anything about him.
Yeah, so D.D. Palmer was the founder. The way that chiropractic kind of started, there was a janitor working in the building that he was in as a metaphysical healer, and the janitor was partially deaf, and D.D. Palmer, I believe, used a book, hit him with the book on accident, and his hearing came back. And then what it was the first cervical vertebra was out of alignment that bad that it was creating a disruption into the temporal bone, creating a disruption into his hearing, and he hit him with that book. The gentleman got his hearing back.
So the metaphysical healer got his hearing back.
The D.D. Palmer was the metaphysical healer. The janitor that was working in his building was a metaphysical healer. He hit this gentleman with a book, upper cervical, corrected first cervical vertebra. His vertebra was that bad out, and it basically allowed him to have hearing back for a little bit. And that's when that happened, something flipped in his head. He's like, that was so powerful what I just did. We made some correction on this gentleman's upper cervical, got his hearing back, and so that's when he started to develop chiropractic.
So did he purposely hit him, or was it an accidental hit, like a book fell off a shelf? Or
I couldn't tell you. I believe that I don't believe it was an accident, but I don't know to what extent and how he hit him.
Right. That part's. And then, so when you say a metaphysical hero, so he was a spiritualistic MD.
I don't even think he was an MD. I think he just, the use of crystals. Crystals hold energy. So I think he was trying to do more healing based on the use of crystals. Mm-hmm. And, he had, I think, a pretty successful practice at that point. But at the same time, when this happened with the whole book incident with his janitor, or the janitor that worked in his building, something clicked and he's like, I got to look more into this. Something happened that was so powerful that gave this gentleman who couldn't hear his hearing back.
I mean, there's so many things that have happened in medicine that have just been accidents.
Right.
Yeah. And then also you're like, whoa, that just that redirected me into a very powerful way that had more stain. But, then you always wonder, how did, scratch my eye before. So we always wonder, chiropractic and osteopathic, like brothers and sisters, in terms of using the body to heal itself. Right. Andrew Taylor Still was a man of the cloth, and he basically, if you read his textbooks, it sounds very revivalistic, speaking of the body and as a vessel of God and that approach. But so it was kind of a similar, but do you think, was it from a religious standpoint or more of a kind of a new age, if we were to put today's words on it?
No, I mean, I would say it was probably more of a religious, because the way that he talks about it is the innate intelligence, the body's ability to heal itself. If you give the body the proper techniques or the proper nutrition or proper alignment, the body should thrive on its own as long as you give the proper things. And then the body itself knows the innate intelligence to heal itself. You just sometimes got to give that little push or that little catalyst to allow that proper
to have happen.
Innate intelligence.
Right. Which is, it sounds very common sense to us nowadays. Right. But again, in the 1800s, that was wow, because they were using, again, in context, strychnine, mercury, bloodletting. They were not doing things that were helping getting the body back into alignment. And Andrew Taylor still had very similar language. He would say the rule of the artery is supreme. And you say innate intelligence, and then what we speak about is knowing, feeling, thinking, seeing hands.
Yep.
So there's just this
Yep.
energy or this pervasive, palpatory ability that obviously can be developed,
Right.
and then you can start to feel and see things
Yep.
that are there energetically. And then now that modern medicine, and I'm sure they showed you this in school, is if my thoracic vertebrae are out of place,
Yep.
then that will have a effect on the corresponding internal organ,
Yep.
and vice versa. If I have a problem with my gut, with my stomach, then the innervation T59 is going to have an issue at the thoracic level that innervates the stomach. So it can kind of give you some insight into what's happening,
Yep.
and then helping the body correct itself.
Absolutely.
Yeah. So how, obviously they developed their own licensing board, because when Abraham Flexner came through and basically steamrolled every school except, I think there were 33 schools left when they went from over 400 medical schools. Yep. They shut down all the medical schools for women. They shut down all the medical schools for blacks. They shut down all the medical schools for minorities. They shut down all the medical schools that were esoteric, spiritualistic, homeopathic. But the osteopaths and the chiropractors remained.
Yep.
Because we had our own licensing boards.
We did, absolutely. There was a time, though, in history in the 1900s where the AMA tried to shut down the chiropractic profession, right?
Yes.
The AMA, they saw that these chiropractors were performing adjustments and we were seeing corrections, but there was no true science behind it, I would say, at that time. And if you think about it, if people are getting better on an adjustment, what's going to happen to Big Pharma?
Going to be a problem.
They're going to have a problem, right?
Yeah.
And we can go into the whole stage of the Rockefellers and how they controlled the American Medical Association and the Breast Cancer Association and all those. So if people started getting better with a simple adjustment by a chiropractor, Big Pharma would lose out on money. So they try to basically shut down our profession multiple times.
Yeah, and they did that. But just to fill that, so it doesn't sound like conspiracy.
Yeah.
So Abraham Flexner was hired by the Rockefeller Foundation.
Right.
Abraham Flexner was a high school principal in Lexington, Kentucky. He was trained or got his master's or PhD in Germany, so he was one of the first individuals to understand the scientific method from an academic standpoint, not from a practicing science like Louis Pasteur kind of thing. And so, sorry, my face is itchy. And so Rockefeller hired Abraham Flexner to go visit all the medical schools and decide if they should survive or not survive. And in today's dollars, it would be about $1 billion that the Rockefellers gave him to implement the scientific method. But of course, behind that was Rockefeller was investing into the pharmaceutical companies. So there was a secondary gain. It wasn't just to standardize medical education. Right. It was to create a medical system that pushed pharmaceuticals. Obviously, there's been great advances with pharmaceuticals, antibiotics. If you cut your arm off, you need nerve reattachment. There's fantastic in the acute medical setting, but in the maintenance of health, longevity, they've certainly not helped, and I would say they probably hurt a lot, but that depends what perspective you're taking, but they've certainly have not helped people maintain higher quality of life, better quality of life, help improve longevity, Well, that's questionable because they have helped improve longevity to a degree, but quality of life in the longevity, chronic disease is way out of control because they don't police the food industry, the pharmaceutical industry, the actually having healthcare policy that helps get people better. It's all based on removal of symptoms, which depends on pharmaceuticals or some kind of medical intervention, as opposed to moving past lack of symptoms and into wellness. Yep. And so the chiropractors, then they had obviously some political support. Mm-hmm. They had a separate licensing board, which is why Flexner couldn't shut them down. Same reason the osteopaths couldn't get shut down. We had political support and we had our own licensing board, so they couldn't shut us down right off the bat. And there were enough powerful people that saw benefit to the osteopaths, probably chiropractors, that there was no way to force us out or box us out because the AMA, the American Medical Association, considered osteopaths a cult until the late 60s.
Yep.
And so they didn't allow us to use their hospitals. We were marginalized in every way. And what we ended up becoming was filling the gaps that the MDs weren't doing, which is we became the family practitioners because all the MDs wanted to go into subspecialties once, 1933 and the invention of pharmaceuticals and surgeries improved enough that they mainstreamed it. And so we became the rural docs, we became the primary caregivers. And then we realigned with the MDs once we saw that there was appropriate benefit from medicines and surgeries. Now, MDs and DOs are essential. I'm board certified by the MDs, but I went to osteopathic medical school, so fairly indistinguishable except in concept. So was there a progression in thought? Because there was definitely a progression in thought in osteopathy. Craniosacral came around with Sutherland in the 20s and 30s, and so tell me about the.
Yeah, so when we talk about the craniopathy with Sutherland and Dr. Major DeJarnett, who was a chiropractor in Omaha, Nebraska, he was probably the individual, and with the technique that I utilize, which is sacro-occipital technique, he came in and he started doing more cranial work and organ work. And in 1929, he came up with something called bloodless surgery. Okay, obviously the AMA and medical associations didn't like that word of bloodless surgery because he was doing organ reflex work, which was creating healing people with acute gallbladder issues, and he was doing some gallbladder reflex points and working on the gallbladder. And he made this change that within the body, person got better. He didn't need to have the gallbladder taken out, and so he kind of developed the form of chiropractic that I practice. But in general, with chiropractic, there's over 200 techniques that have developed from day one, if not even more, right? Okay, there's diversified, which is more of a hands-on. You hear the audible cracking. You have an activator, which is the use of a tool to put a slow impulse into the vertebra, okay? You're not going to get that audible cracking or pop that people think about when they think about chiropractic. But the development started from, when D.D. Palmer did that one adjustment on accident by a book, to where we're at today, where you have 200 plus different techniques that chiropractors can utilize to help that individual get better.
Right, so it's like subspecialty.
Correct.
Right, and so when you say this surgical approach that you did, it wasn't actually cutting the body open. It was more of like a visceral release.
Correct.
Like finding a strain pattern inside the abdomen and then releasing the strain pattern. And
correct.
And then it would be a corresponding improvement in symptom.
Yeah, because he coined it a chiropractic manipulative reflex technique. After the fact that he couldn't use bloodless surgery in 1929, he had to change it because he wasn't really doing surgery, right? He was doing more visceral manipulation, adjusting areas of the spine that related to that organ. There was a lot of the visceral work and reflex work that he was helping these individuals getting out of acute pancreatitis, getting people out of the acute gallbladder issues, the constipation, the colic, things of that nature. And so he changed it to chiropractic manipulative reflex technique, which you said visceral work, and that's one of the biggest things that I utilize in my practice.
And that's how, going back, how I ended up aligning with one of your partners years ago was she was speaking SOT, sacro-occipital treatment, SOT, right?
Sacro-occipital technique.
Yeah. And, as an osteopath, we do craniosacral, and they're basically just the same thing with different names, And then we look at the body. I look at the body forward to back. So I'll name a lesion looking from the front of the body, and sacro-occipital looks at it from the back of the body forward.
Yep.
But there's very central. I have not found anything very different other than you guys call it SOT and we call it CST.
Yeah.
And then Sutherland was an osteopath, and then who was the chiropractor?
Dr. Major DeJarnett. He was a chiropractor.
And did they collaborate together? Or
They did
just
actually collaborate, and they collaborated a lot in the 1920s, 1930s. And, they shared work together, and they developed what you guys have as your technique of, what do you call it? The
craniosacral.
Craniosacral, and he calls it sacro-occipital.
Yeah. And it's just basically how we pursue the bodies.
Yep.
And when did the chiropractors, because I know nutrition's a big part of chiropractic, which you don't hear, but I think medical students get 10 minutes of nutritional education during medical school. I trying to think of any significant nutrition. We had a class second year where they did a survey of all different alternative medicines just so we would have at least a very cursory understanding. And so there was a nutritional class in that, but it was lumped into alternative and complementary medicine, but except for certain aspects. Like, okay, if you got celiac disease, you don't eat gluten, and some aspects, but it was all disease based. Yep. So when did chiropractors incorporate in nutrition as part of one of the tenets to realign the body so it can function appropriately?
I can't tell you that it happened early on in the chiropractic profession. Dr. Lee, I don't know if you've heard of Standard Process. It's a company.
I know that.
So he started Standard Process. Don't phrase me on his correct name, but he started doing more of a nutritional component to his practice because he saw that adding some nutritional components to an individual, say had a gallbladder issue, he'd give them a supplement that was specifically for gallbladder, nutritional component. And, that was, I want to say, early 1900s too. So that was a big component.
Very early.
That's the thing. For us, what we put in our body should be, in my opinion, is really the start of our health. If we're looking at a health and wellness and we're trying to develop a wellness type care, what we put in our body is going to affect how we feel, how we act, how we think, physically, mentally, and emotionally, right? So I'm glad that at a young time that there was that nutritional component that was brought into the chiropractic practices.
Yeah, no, that's really important. And at the same time, in the late 1800s, early 1900s, Weston Price was a dentist, and he did around the world. I don't know all the specifics, but basically he went around the world to look at dental care in different indigenous tribes, different cultures. And what he noted was those individuals who grew up, lived indigenous cultures and ate healthy foods, none of them had dental issues. Yeah. They had perfect teeth. They didn't need braces. They didn't have a history of dental problems. And that's where his foundation arose, to focus on proper nutrition as a means to health. Yep. And again, it seems basic to us now, but you still look at how the majority of people feed themselves or their children. It's not that healthy, and it's very processed, and it's they've surrendered to convenience over health. But in the late 1800s, early 1900s, that was foundational. Yeah. Again, we didn't even have the scientific method. People thought that flies spontaneously arose out of rotten meat. In the 1800s, it was, they didn't realize that flies would go lay. They didn't realize that flies would go lay eggs in rotten meat, and then they would fly up later. Yeah. It wasn't until they put a membrane over a jar with rotten meat that they realized now no flies are coming out of there, because now we've kept the flies from going in. Right. But they thought it just spontaneously arose out of that. So, yeah, so it seems basic to us, but it's very foundational.
Well, I think part of the problem is if you look at the food guide pyramid, which supposedly they're going to change, right? If you look at the food guide pyramid, this is what we were taught as kids. This is what parents are taught, right? You have the base, which is grains. At the very top is our fruits and vegetables.
Right.
Okay. Grains are very inflammatory.
Yeah.
Okay. They create excessive inflammation in the body. So you follow the food guide pyramid. If you go do a regular nutrition, or what someone would say, what we've been taught, you're going to have systemic diseases as a result of the food guide pyramid that we've all been taught.
Right.
So unless you educate yourself, you learn what proper nutrition should be, that's when you start going to see more wellness care. People feel better based on the food they're putting in their body. They reduce the grains, the dairy, increase fruits, vegetables, lean meats. Guess what? They're going to be healthier.
Get healthier. Yeah. Well, we're not designed, if you just looked at, also just us as outside of modern conveniences with grocery stores, it wasn't until my grandparents, 100 years ago now, less than 100 years ago, they would have to go to the farmer's market every day to get fresh food, because there wasn't refrigeration in the 1920s and 1930s. It wasn't until the 40s and 50s that people started to have refrigerators in their house. And so everything was farm to table. So you ate what was fresh and local, which was very little grains. Mm-hmm. You didn't have bread and grains and all that every day. And you didn't eat a lot of carbohydrates because that wasn't readily available. Yep. Maybe you had some maple syrup, and sugar certainly wasn't a big deal back then. So
it was sugar.
Healthy. It was all healthy healthy type. And now, obviously, so many extra calories in our diet, and we were eating way too many carbohydrates. Our bodies aren't intended to eat this many carbohydrates. We're designed to be on more of a fasting to balance foods as opposed to being overfed constantly. So our body doesn't know what to do with it, and we're getting chronic disease.
Yep. You go back to the hunter-gatherer diet.
Yeah.
Okay. They basically went out, hunted for their food, and gathered their food from vegetables and berries.
Yeah. The paleo.
Yep.
Well, let's get down to the mother-baby dyad.
Yep.
Okay. And so chiropractic care. Can a pregnant mother have chiropractic care?
Absolutely.
Okay. Are there any contraindications to having chiropractic care? And I know that there's over 200 different subspecialties in chiropractic care. So there might be some in there that are contraindicated.
Yeah.
I don't know.
Yeah.
But I'm just, and just to kind of highlight how, just to highlight some of the nuances, like I really identify with this SOT form because it's like craniosacral, and I think if you unwind the body and that works great. But I remember there was a chiropractor that I became friends with in residency, and she would take an x-ray of your neck, and then the first or second vertebrae, she would do these very specific calculations and then tap. And then that was supposed to be the realigning vertebrae to every other vertebrae underneath it, which is a completely different, very almost like engineering approach to it.
Yeah. I mean, that's called upper cervical technique. Their philosophy is you have your first cervical vertebra, the spinal cord goes through that vertebra first. So if you make a correction of that first cervical vertebra, the innate intelligence of the rest of the spine should line up if you make that proper precision adjustment. Obviously, I don't love taking x-rays on a pregnant mom, right? So if that's a technique that they did, right? Obviously they do take an x-ray of the upper cervical, and it's usually like 5 views because they want to do a lateral, an AP, an open mouth, a flexion extension, and oblique views. Okay, I'm not going to take seven images on a pregnant mom.
Right.
I'm not going to expose her to the radiation. Right?
So that's why I wanted to highlight that there might be some differences. Correct. So, but in the form sacro-occipital that you practice, and probably a lot of other styles, can you treat pregnant moms?
Absolutely. Yeah. That's one of the best things. I have a couple midwives in town that refer a lot of patients to me for the reason being it's the sacro-occipital technique. It's a lighter form of an adjustment. Okay. I may be doing more visceral type release around the baby, right? If there's restraints within the viscera of a mother's stomach, okay, it can make it so that the baby can't move properly. It may get stuck in a certain position. So doing some of that visceral fascial unwinding type of work will allow that baby to have more room to potentially thrive, get the movement it needs, proper circulation, blood flow, proper position of the baby, okay? A baby that's breech, Webster technique, which I do a modified version of the Webster technique, is a great thing to do on a mother to help a baby go back, head down. Okay. If the baby's transverse, if the baby is breech, if the baby's sunny side up, okay, doing some of that visceral type release allows that visceral to unwind, gives that baby more of a chance to flip and go head down when time is ready for the mother to give birth.
Right. And just so people at home can understand, you can do this at home, is if you stand up and turn your toes in, so you're very pigeon-toed, and then take a deep breath in, and then compare that to turning your toes out wide like you're a duck walker, and take a deep breath in, you'll notice that when you in-toe, your breath is restricted. And all you've done is just turn your legs. But what's happened is you've turned all the fascia, because the fascia is the only tissue in the body that runs continuously throughout our body. Yep. It's the highway for the nerve arteries, vessels, lymphatics. And so it has to be continuous because there has to be a roadmap from top to bottom for all of those essential, transportation mechanisms to work. So when you in-toe, you're winding the fascia in, you're turning the diaphragm inward on itself, and then you feel a restricted sense of breathing. You duck your feet, and you take a breath. It just opens up much less restrictively, very easily. And so that's what's happening to a pregnant mom. The baby's in there moving around, kicking around, and maybe her leg's a little tight, and then that creates a strain pattern up through the uterus, and then now the baby's stuck in a little position. Yeah.
There's that, and with sacro-occipital technique, we use pelvic blocks, SOT blocks, And so for a pregnant mom, to adjust the pelvis and the sacrum, we put the mother on blocks face up, and that helps realign that pelvis. If a pelvis is nice, nice and open like this, if the pelvis is in a neutral position, but if you go like this and twist the pelvis at all, that circle for where the baby comes out gets minimized. So balancing the pelvis, balancing that sacrum, releasing the pelvic floor allows for a more safe, effective, and efficient birth for the mother. It's going to be a lot easier for her. She's still obviously going to have pain on the contractions, but having the proper alignment, the pelvis aligned, the pelvic floor nice and relaxed, it's going to allow for the proper pushing of the pelvic floor to allow that baby to be delivered more effectively, efficiently, and healthier for the baby.
Yeah, and it also helps moms, because what I would do with Helen was she would get reflux, and I would just do a diaphragm release, and just myofascial release, and she'd stop refluxing, and then she'd feel the more space in her abdomen, and she wouldn't reflux, and that'd also help when she would get the round ligament pain.
That's a huge one.
Yeah, I would release the tension there, and then the round ligament pain would go. I mean, it's not a permanent fix. No, it's just, the body would go back out of alignment, and the pregnancy's pulling on her body, mom's body, in a way that, it's going to go back out of alignment. But there's other benefit, postpartum, and I don't know if you, tell me what your postpartum experience with moms is.
Yeah, so depending on how non-traumatic, how traumatic that birth was, the mom sit in labor for, 13, 14, 22 days worth of labor, that's a lot of pressure and force put on the sacrum, put on the pelvis, the stress that the mom goes through, the adrenals firing, okay? It's going to create a dysfunction within the whole body. But if a mom comes in shortly after birth, as long as they don't have, say, a C-section, I can still work on a C-section mom, but it changes the way that I work on her. Okay? If a mom comes in, normal vaginal delivery, everything went pretty well, that pelvic floor opens up. It's got to open up, right? We get the release of the ligaments from the sacrum to the ilium to allow for that pelvic floor to open up, to allow the diameter for the baby to be delivered healthier and more effectively for the mother. But afterwards, there's going to be some instability in those SI ligaments, right? So stabilizing the sacrum, stabilizing the ilium shortly after birth, the mother giving birth, is going to allow those ligaments to heal in a proper position if I can get them balanced shortly after mom delivering baby.
Yeah, while the oxytocin's releasing and everything's a little loosey.
Correct.
Because everything had to become loosey to let the baby out.
Yep.
And then as it starts to
come back together, we want to make sure
we're putting the
baby, that mother's in a proper position to allow that healing. Because if she doesn't get care, and say she had a posterior ilium, or the pelvis is rotated back on one side, forward on the other, and as all the hormones start to go away and things get tight again, we don't want them to get tight in the wrong position, right? Because then it's going to take a lot longer for me to be able to make those corrections later on down the road. I'd rather do it shortly after the birthing process, while we still have a little bit of the hormones in there, get the right proper position, so as the hormones subside, we're in a proper position for healing to occur.
And before I jump into treating the newborn, I had a mom years and years and years ago who, after delivery, we were just doing social discussion, and she said that sex was very painful since the baby came. And I said, well, there's an osteopathic release that we can do. And we did it. And next time she saw me, she came in and she threw her arms around me. She was so happy. She's like, everything's back to normal. And all it was, I don't know how an OB would have handled that, but, it would have not been a simple release. Right. It would have been testing and prolongation and continued discomfort and then social marital issues but it was that simple. Same thing uses actually the same technique for releasing period pain when moms cramp or women cramp really bad. You don't have to have had a baby to have that release for menstrual cramps.
Well, that's the thing too. Pubic symphysis, right? The pubic bones separate a little bit in the front too, right? You have for us, we call it a glandular technique, which is part of that CMRT, chiropractic manipulative reflex technique, is based on the pubic bone. So if we have a misalignment of the pubic bone as a result, we may have some glandular issues down the road, which may create other hormonal issues too. But, if you didn't do that correction at that time, like you said, how long would that have prolonged on traditional type medicine? They may have been treating the symptoms, but to get to the root of the cause may have never happened. And like you said, that would have created marital issues down the road. So,
Well, they would have gaslit her. You know, it was like, oh, this is all in your head. This is you. This is a you issue. When no, it was that things reconstituted incorrectly, and it was super simple. It took 5 minutes.
Right.
It was 5 minutes of nothing.
Yep.
And then she went on her way, and you know, obviously,
save that
being
marriage.
hugged afterwards showed no more questions were needed. I mean, no answers were needed. So with babies, you know, treating babies right after birth.
Yeah. So, you know, I've treated literally, it's a weird, funny story, but my wife gave birth on June 10th. One of my patients was trying to do at-home delivery, and it just didn't go well, so she got transported to the hospital. I get a phone call from my front desk. Hey, such and such had a bad birthing experience. They're in the hospital now. And I'm like, hey, where are they at? They're at NCH, right? That's where the deliveries happen in this county.
North Collier Hospital.
North Collier Hospital, yep. And I said, you know what room she's in? And they told me, and I'm like, I literally walked out my door, went to the next door. My wife was sleeping at the time, went to the next door, worked on that baby. I think it was about 2 hours after the baby was born.
So right away.
Failure. I won't say it was failure to thrive, but the baby, you can just tell that the trauma from the birthing process itself created a little bit of issue with the mom, created an increase in that adrenal activity, the stress. Baby's going to get affected from it a little bit, but baby was stuck in the canal. Okay, if a baby's stuck in a canal for a long time, all that pressure being put headward down is going to create a disruption within the cranial vault, within the cranium itself. So I went over there, did some simple cranial work on the baby just to get that cerebral spinal fluid flowing the way it's supposed to, and also help with the proper expansion of those sutures.
So just so fill in some spacing in there. Yep. So when the baby's engaged in the perineum, in the birth canal, there's obviously contractions because they're trying to squeeze the baby out. The baby's cranial bones, the plates and the skull are not fused.
Correct.
So that's why sometimes you see babies have an Egyptian-style head or elongated posterior, or there might be overriding sutures, because with that baby getting squeezed in the birth canal, designed to help so the baby can come out. Yep. We're not born with a bowling ball head that that can't compress or change or become malleable to fit the exit path. And those cranial sutures overriding or an elongation of the head can have effect on the cranial nerves, correct, which basically are the primary nervous operating system of the body. And most of the time, we're going to talk about vagal nerve.
Yeah, cranial nerve 10.
Yeah, or the glossal. So we're going to focus on those, because if the bones of the skull didn't return to its proper alignment, and then you can have compression on the vagus nerve, or the glossal. So you'll end up with tongue issues, inability to correctly mouth the breast, suck correctly, tongue thrust, all of that. Or there might be a lot of spitting up because of the vagal nerve, which innervates majority of our GI tract. There might be constipation. There might be explosive poops. And all it requires is, I don't know how many kids we've kept off GERD meds because we send them your way. Or
Yeah, and that's the thing. So people don't realize, I brought this skull here, whether you can see it or not. This is a neonate skull. This is probably about 26 weeks gestation, okay? But if you look at base of the skull, you have the occiput, right? You have the temporal bone. You just talked about the vagus nerve. Well, vagus nerve, cranial nerve 10, cranial nerve 9, and cranial nerve 11 all go through the same canal, the jugular foramen, okay? That jugular foramen is between the occiput and the temporal bone, okay? If there's any compression on occiput, any compression, or they use forceps for any reason, grab the skull, especially try to get the temporal bone and pull the baby out, grab the occiput, pull the baby out, we're going to get a lot of force put through that jugular foramen. So you're going to affect glossopharyngeal, throat and swallowing, vagus nerve, large parasympathetic innervation to the gut, okay? It's innervation to the heart, and then spinal accessory, which is the muscles of the throat as well, okay? Hypoglossal nerve, hypoglossal canal is part of that occiput. So 9, 10, 11, or 9, 10, 11, and 12 cranial nerves are affected in the birthing process from the occiput and temporal bone itself. So as a chiropractor, as what we do in my practice, it's just a gentle, easy chiropractic manipulation to get those nerves firing the way that they're supposed to allow for proper tongue movement, proper swallowing, and then, again, affecting the gastroesophageal sphincter from the parasympathetic innervation from vagus, and then the rest of the gut.
Right.
People don't realize that as a chiropractor. They think, oh, what am I just going to adjust the baby's neck? It's not how it is with the baby.
No,
that's a misconception. But not many people think, hey, you can adjust a baby, and what for? We just kind of went through just a minimal portion of what we can do and help on a newborn.
Right. And just to talk shop for a second, when you say you did cranial on a baby, would you say it was cranial or was more just myofascial releasing?
It'd probably be more myofascial release.
Because the reason I asked is we were taught you can't because the bones aren't fused. I mean, how can you take a bunch of individual bones that aren't fused and actually do some cranial work on them because they're just kind of floating in space.
Right.
And so it's more of unwinding the tension patterns that arose from the birthing experience.
Yeah, it's what we call an indirect adjustment.
Yes.
Okay, we have a direct adjustment, which is what most people think about when they think about a chiropractic adjustment. We find the area that's not moving, and we adjust into the area that is stuck. An indirect method is going the opposite direction and allowing that fascial tissue to unwind. So a lot of it is an indirect adjustment, but it's more of a fascial unwinding that occurs to help the cranial bones, I would say reposition, just take that tension off the dura, takes the tension off the dura, opens up those foramen where those nerves come out, and alleviates a lot of that compression that may occur, allowing those nerves to fire the way they're supposed to.
Right. And again, just for people at home to understand this a little bit more, is I'll explain it to families is if you and I had a bed sheet, like a twin bed sheet, and we close our eyes and we're both pulling, you have two corners, I have two corners, and we close our eyes and we pull it tight, and then somebody sets a tennis ball on there, you will feel the tension towards the tennis ball.
Right.
And so that's where when you have the forceps or they're engaged in the perineum too long or even just a normal delivery, there can be a sticking pattern and you just have to unwind that. You basically have to figure out how to move the ball off of the sheet so it's no longer pulling on the sheet.
Right.
And you can do that with your eyes closed. You don't. I'm not talking about just flipping the sheet because you can't do that with the head. I mean, I just can't take a baby's head and just go, whoop, oh, it's all better now.
I'll lose my license if I do.
Yeah. So, obviously you just follow the tension. And I prefer, when I do that stuff, I prefer indirect over direct.
Absolutely. Me too.
Only when I get a stubborn indirect do I go to direct.
Yep.
Yeah. And I just find indirect it's
more
It's like
effective.
telling the body, it's like being a body whisperer. It's just like, you don't have to be scared anymore. Oh, okay. And then it just opens up for you.
Absolutely.
Yeah, and it's remarkable again. And with the other area, let's move. One, it helps reflux. So let's just talk about common newborn refluxing, constipation issues, diarrheal issues, oral suck swallow issues, sleeping issues, irritability issues, eventually teething issues, and then let's talk about plagiocephaly because that's huge. I have practicing 26 years. I've sent all my plagios to you guys. And I only had one kid need a helmet. Why? They didn't go to you guys. Instead, they went the traditional route and they went to the oral facial surgeon and they did the star scan and they got a helmet because their girlfriend said that was the best way to go. That was okay. Then you're the only kid in my practice that's ever had to have a helmet.
That's the thing. Helmet is for aesthetic reasons only.
Right.
Okay. With what we do in the plagiocephaly, which we'll go down the road, we're actually allowing more for a functional change to occur within the brain itself. And we can get into that if you want to talk plagiocephaly down the road. But, that's one of the biggest things is it's educating parents, thankfully you're educated and you've sent a lot of patients to us with the plagiocephaly and we've made the changes that we needed to. We may not have gotten the most perfect shape skull, but that's not what we were trying to accomplish. We were making sure that the baby's going to meet its milestones. We're getting that functional development of the brain that we need because we take away those restrictions within the dural system by doing some cranial work with the baby.
Right.
And when I say cranial work, okay, you talked about myofascia. It is a myofascial because we're doing gentle maneuvers to help release the dura underneath, which allows the proper cerebral spinal fluid flow as well.
Right. And just so people, when you say we didn't get the head into a perfect, ice cream cone head,
Correct.
That if you have a helmet, you're not going to get a perfect ice cream cone head.
No.
The child that didn't need the helmet, and it's easy for me to identify who's not been properly helmeted or chiropractically treated is there's still kind of, with a trained eye, it's easy to see. But once the kid grows hair, it's almost not visible.
No.
And so, perfection is not where we're ending up, because even a kid that didn't have plagiocephaly, very few people outside of Denzel Washington has a perfectly aligned head.
Right.
Yeah, and a couple other people. Very few people are symmetrical left and right and split top to bottom.
Yep.
Yeah. So when you're saying the brain development with plagiocephaly, go through that one a little bit.
Yeah. So if say we have multiple strain patterns, is what we call it in sacrooccipital technique. Dr. Williams, who's a chiropractor in the UK, kind of came up with a way of treating the different forms of plagiocephaly. Okay, plagiocephaly is a broad term for misshaped head. Okay, but say we have what we call a plate strain or an A to P strain, where you see, baby's got a little torticollis. Always turn the head one side. Head's getting compressed on that side. That side of the head that the head's turned to is going to go anterior. It's going to come forward, right? So gently doing some work is going to open up, bring that right side that's anterior back posterior a little bit. And by doing that, it's going to help with that jugular frame and vagus nerve, glossopharyngeal, spinal accessory, temporal bone, all that.
And what's the window to get to kids with plagio?
I would love to get there while the sutures are still open, right? Now, if you talk to Desjardins, the sutures never actually solidify, okay? If you take your hands and you take a deep breath, temporal bones open up. Okay,
that's a palpatory skill.
It's a palpatory skill, right?
It takes a while to
so there's no
one.
true ossification of the sutures, but I would love to get that individual where we still have a pretty large anterior fontanelle, which is the soft spot, just so that I know I have time to make the changes I need to without fighting against any restrictions. Right. So sooner better than later when it comes to the plagiocephaly patients.
Yeah. Okay, so but kid of an age?
I think we've treated up to 2-3 years old.
And then I guess what I'm getting to is, like, at 2 months, I might start to see 1 month, 2 months, I might start to see some torticollis or some early plagiocephaly. Yep. Sometimes positioning the kid and feeding them differently, to stretch the neck, teaching the parents how to stretch the neck.
Yep.
Stabilizing the hip and the shoulder, and then put them in a noggin nest. And sometimes that's all we need.
Right.
And then at 4 months, if I have not seen significant correction, they're on to you guys.
Yeah.
Because I'm 6-7 months old is when you 100% want to be well on your way.
Correct.
Into correcting the plagiocephaly, because it just becomes harder and requiring more treatments.
Correct.
Past that point.
Yep. Yeah, like I said, those ones that are 2-3 years old, like we've talked about, it's going to take a little bit longer because I'm having to work more with the changes that have occurred over those last 2-3 years with that baby. More stress may be put on from the firing of the SCM and these muscles, getting the head control. It's going to start to lock down the head a little bit more. So I have made changes. You can still make some like physiological changes on those plagiocephaly babies at 2-3 years old. But like I said, I'd prefer them earlier.
Okay. And I'm trying to think if there's anything else in that plagio world. What about ear infections? Explain how an adjustment can help with ear infections.
Yep. So ear infections is one of those things. Otitis media is what we call it, right? Ear infections can be a result of the temporal bone not moving the way it's supposed to. But it's also a lot of the time if a baby has reflux, right? Baby reflux is up. We have a little hole at the back of our throat, fossa of Rosenmuller. Okay. If we reflex up, some of that contents gets in that fossa of Rosenmuller, gets up into the eustachian tubes, and we start to get some ear infections there. That can maybe be a dysfunction of the vagus nerve. Okay, we want to be able to get the baby not refluxing, which is going to help keep those eustachian tubes hopefully clean. But if we don't, if we've done that and we're still getting ear infections, we call what's called a temporal rocking technique. Babies, if you feel behind the back of your ear here, you have the mastoid process. Babies that don't have really good head control don't have that mastoid process yet. So for an individual with an ear infection at an early age, doing a temporal rocking technique, which is basically grabbing the ears, doing a rocking technique, helps get the temporal bone going into flexion extension, which will help the eustachian tubes allow to drain properly.
Yep, and it significantly helps. Yeah,
and one thing too, if you look at a baby that say maybe clenching a little bit, or we're starting to teeth and we're clenching and grinding our teeth, you have your pterygoid muscle. That pterygoid muscle, which is you have 4 muscles of mastication. That pterygoid muscle, if it's getting overcontracted and tight, may start to compress on that eustachian tube. Then we start to have that buildup and potentially causing, ear infections more prominent, more prevalent. And so gently doing some release in that pterygoid muscle, which is one of the muscles of mastication, like I said, may help release some of that tension, allow that eustachian tube start to drain and get the proper drainage that we need.
It helps a lot, yeah. Which is always very beneficial because, again, if you just in-toe, out-toe, you can feel the restrictions. Right. It's not hard. Even if you just stretch your neck up and spray your neck, you'll feel an opening through here. So it's not too woo-y to understand that there's clearly a connection, but people unfortunately just don't think of the body in terms of this functional approach, and a large majority of Americans are, hopefully with this video, we're going to start getting more a broader understanding that medicine comes in many different forms, and everybody should work together and have broader understanding of what modality you need at different times.
At the end of the day, we're both in the same thing. We want the patients to get better.
Get better.
That's what we do. Right. Whether this doctor does something that I don't do, but that's going to get the patient better, that's what we care about. At the end of the day, money comes and goes, but getting the proper care for that patient is really why we're in this, and that's what we want.
Yeah.
I just hope, again, with this video alone, hopefully we can educate a little bit more on the things that chiropractors can do with a proper chiropractor that knows what they're doing to maybe be able to prevent the use of antibiotics as much as we need. Okay, there's a place for antibiotics, don't get me wrong, but if we can get those eustachian tubes draining and get those ear infections less prevalent, we don't need antibiotics as much. We're going to save the baby's gut long term. We're going to have other issues down the road by preventing that.
Yeah, and it's something I always talk to families about. I said, if a child's having recurrent ear infections, we're going to look at nutrition. We're going to look at structure, which is chiropractic. We're going to look at environment. And that's much better than having to get tubes put in your ears and some anesthesia and having that path go down. With one of the criticisms I hear about chiropractic is you'll hear a chiropractor say, well, if you come to us, you'll never have cancer. You'll never have this, which, it's obviously nobody's got the angle on preventing on any, people are too diverse and we're up to too much nonsense to be able to say that we'll be able to stop. And so it's not that you're. I'm not saying that that's you, but that's one of the criticisms I've heard, and I've experienced that. You come to me and you'll never have cancer, or some extraordinary event, which is, but not to get any. Unfortunately, they get highlighted too often, right? And in any profession, you've got the good guys and the guys who
anywhere aren't
doing that great, and are looking to make some money, and throwing out that kind of potential. You're ambulance chasing. That's what that is. You're looking for people that are in high stress. Need something to feel better, and
they'll buy on emotion.
But I only want to address it just so we kind of just same thing as like osteopaths or quacks, and we don't.
Okay, great. They can call me a quack, but if I'm making the changes and getting the results that I want in my practice, and I'm getting babies feeling better and mothers happier and making those changes, you can call me a quack all you want.
Right.
I'm getting results.
Right. And
so have at it.
I don't You sit behind your keyboard wherever you're at and say that. What I love is like on some of my posts, because I'll advocate for supplements, because I think that, one, we know from the FDA that the majority of Americans are deficient in essential vitamins and minerals. I mean, it's just hands down, NHANES study. We've been following people for 30, 40 years, and we know what their nutritional status is. We know what their health outcomes or negative health outcomes are from being improperly fed and not taking supplements. So it's right there. But then people are like, oh, you give supplements, so therefore you're a snake oil. And I'm just like, this doesn't even make sense. It's just like it's people get so locked into a perspective, and then they get into fear, and then they just attack without knowing anything.
They're not educated.
They're not educated.
At the end of the day, we want to inform our patients.
Burn little witches.
Exactly.
Yeah. All right. So now with athletics, because you work with some professional athletes, we have spring training down here in our neck of the wood, and so obviously the professional athletes find a lot of benefit to being in proper alignment.
That's the thing. If a vertebra is out of alignment, can cause an impingement on a nerve. Say it's an impingement of somewhere in the cervical vertebra, lower cervical vertebra, getting impingement, creating a dysfunction down into the arm. Nerve's not firing to the myotomes, the muscle contractions properly, and we're creating either maybe some atrophying or just improper biomechanics as a result of nerve not firing the way it's supposed to, or giving the innervation that we need to. So, this goes with a pediatric patient, an athlete, or whoever. If we take that nerve interference off, nerve's going to fire better to wherever that interference was happening, whether it's an organ, whether it's a muscle, you're going to get better performance out of that area.
Yes.
Right? So, I treat a lot of athletes. When I first started, I thought I was going to do all athletes, but I love my pediatrics more than anything at this point. But yeah, with athletes, if you give the body the proper alignment, the proper nutrition, they're going to perform at a higher level.
Right. It just makes sense.
And some of these athletes, they may not even come in with a complaint. They just know that when their spine is aligned in the proper position and the cranium is doing what it's supposed to and the pelvis is doing what it's supposed to, they perform at a higher level. I worked with Red Sox for a couple of years. They would go up there about one weekend a month. I treat a lot of the athletes. Now, they already had a chiropractor on their team. However, what I did was a little bit different. They weren't getting the organ work. They weren't getting the cranial work. It was just something different to them. And they saw, I took a kid that was from AA. He started seeing me, and I just was doing some organ work on him. Okay, his liver wasn't detoxing the way it's supposed to, so his body was filled with toxins. I did some liver work on him and made adjustments on T8, which is liver. He's like, why doesn't my chiropractor up there do? I'm like, it's a certain technique, and what he's doing isn't wrong. I'm just doing a different technique that's going to help optimize your system from being able to function at a higher level, right? If the liver is not working properly, we get a buildup of those toxins. Buildup of those toxins is going to make it so that your stomach may not be digesting as well. It's getting a backup there, and when we get that, it builds up in the whole system. Get back in the lymphatic system. We can get the headaches. We can get the misfiring of the nerves down the arm. All that. So, working, organ work, adjusting, cranial work, we're allowing that body to function at an optimal level.
So you went from AA, and he got into the big show?
He went to AA. He actually saw him because his daughter was referred to me from a chiropractor up in Providence, Rhode Island, which is where one of the, I think,
farm teams
was. He referred his daughter to me, brought his daughter in. I was doing this organ work, doing some cranial work. He's like, what is this? I'm like, this is chiropractic. This is what I do. He's like, I've never seen this. This isn't the chiropractic that I'm used to. He's like, I want to see you. And probably with me starting to work on him and his body starting to function better, he went from that AA team. He made the 2016 All-Star team. He was a knuckleball pitcher for the Red Sox.
Look at that.
And he's like, you helped not only align my spine, which I was getting that, but it was a different form of chiropractic, and I was looking more at the organ work and doing some cranial work. Okay, people don't realize hand-eye coordination. If we go to the sphenoid bone, all muscles of the eye except one goes to that sphenoid bone or attaches to that sphenoid bone. Okay, your optic nerve, ophthalmic nerve, trochlear, abducens, all those nerves go through the sphenoid bone. If that sphenoid bone is off, even just a little bit, it's going to affect the way your eye movement is. It's going to affect hand-eye coordination. So doing some cranial work on that sphenoid was making a huge difference for the batters because they'd see the ball coming in. If that sphenoid bone was in optimal position, those muscles are going to fire a lot better.
Right.
Okay. Go to that, eyes working better. We go to our kids that have visual processing issues. Okay. If that sphenoid bone is off just a little bit, it's going to make it so those eyes pull maybe a little bit on those muscles. So they're reading just to read, they're not retaining. If you can get that sphenoid balance and get those nerves firing appropriately, muscles contracting the way they're supposed to, then we start to see better reading ability.
And the sphenoid is the last step in a multi-step process because you have to have everything else out of the way to get to the sphenoid.
Yep, sphenoid in the technique we do is called the keystone to the skull. Mm-hmm. Okay?
Yes.
Sphenoid itself has got greater wings and lesser wings, but also within that sphenoid bone is your sella turcica, which is what encases your pituitary gland.
Right.
If sphenoid is off, you're going to have a disruption into the pituitary potentially. Then you're going to see issues with maybe growth hormone production.
Day and night rhythms, everything.
All of it.
Everything, that is the getting to the sphenoid is where you want to get.
Yep.
And now, so you mentioned something earlier, like the dad was, this is what chiropractic is, because most people think it's HPLA, velocity, low amplitude, the crack. But it's
Well, you have these YouTubers on there that are putting microphones on and they're cracking away, and they're getting tons of views and tons of clicks. For some people, that's very beneficial and it's great.
yeah, right.
And I do some of that. It depends on the individual, but there's a lot more to it than just those high velocity adjustments.
Right.
Okay. And with him, it was addressing his diet. Okay. I hate to say it, but a lot of those players, they don't eat the best. They have a team cook, but I've been in their team meals, and they're not eating the best foods that they should be, which is sad. One of their top pitchers, he would go home after a game and he'd drink a lot of beer and he'd have a pizza. And his wife would always say to me, "Can you please talk to him about his nutrition?" Because I feel like he was an all-star player. He can go from here to here if he would just change his diet, change his habits. He wouldn't do it. I mean, that's his choice. But at the same time, his wife knew that it would make a difference, but he didn't want to hear it.
And that's everybody's got their hang up.
Yep.
It doesn't matter who you are,
Yep.
even if you're all-star baseball player,
Yep.
you're still going to have hang-ups. And that's one of the things I talk about kids all the time. I'll say, you look at professional athletes, because these kids look up to professional athletes in high school, and they'll say, the parents are like, "You got to talk to them about nutrition." I'll say, look at your professional athletes. They are limber because they're going to have more power, because the muscles have more distance to contract, so there's more power, less likely to get injured. And so you watch these NFL guys before the game, they're doing hurdle stretches, and they're all the way down.
These are 300-pound gentlemen doing this. But
and then also the diet, because your body responds to the nutrition you put in it, because you need to have the right nutrients in order to fire the mitochondria, which is the powerhouse of the cell. You have to be able to power up the cell in order to activate your muscles or your vision or whatever, detoxify your body. So when you're in the game, you're clean. So you can, all of that's really important. So yeah, no, it's the whole 360 on the approach. Again, osteopathic's not going to solve the world, just part of the equation. Chiropractic's not going to solve the world. Traditional MDs aren't going to solve the world, but it's just understanding how to use the appropriate medicine so you don't get over-medicalized unnecessarily. Right. You don't spend money that's not needed. Be like that poor woman who would have, been gaslit for the rest of her life until she found somebody to release that tight muscle that was affected from childbirth, so she could enjoy her marriage again. And that it's very simple. And so that's what I'm hoping that people will gain an awareness from all of this. And so tell me about you just started your own practice. You were with a big group that I've been very intimate with over the years.
Yep. Nope, I was with a place called Fit for Life here in town. It was a great place. I learned so much. I was there for 14 years. I was there from 2011 to just this last December, and I opened up my own practice here. Started here January 2026, and it's time for me to do my own thing. I was very appreciative, very grateful for what I learned at my last practice, but it was time for me to do my own thing and just kind of spread my wings and still give the great care that I was taught and given, and just trying to spread the health forward. But yeah, I'm here in Naples, Florida, right off of Airport in Vanderbilt, and it's a beautiful spot to be in.
Yeah. Well, good luck to you, and thanks for joining us today.
Thank you.
All right, take
Appreciate
care.
it.
Thank you for joining us on the Dr. Thornburg Wellness Podcast. Come for the science and common sense. Stay because it works.